everyone. In today's clip, I will talk a little bit about postnasal drip. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, postnasal drip happens when excess mucus accumulates in the nasal passages and drips down the back of the throat. The nose, throat, and sinuses continually produce mucus. This is a thick, slippery substance that helps prevent the airways from drying. Mucus also helps protect the body from germs, dust, pollen, and other environmental pollutants in the air. Mucus mostly does its job in the background without being noticed. It usually mixes with saliva throughout the day, and we either swallow it or blow it out the nose or spit it out. However, it becomes more apparent if the body produces too much or too thick of a mucus. When this happens, you may feel the substance is sort of dripping down the back of the throat. This excess mucus can also cause other symptoms like cough, especially when you're lying down, nausea, ear discomfort or infections, and bad breath. You may also experience sore throat, throat clearing, and a raspy voice. Common causes of this issue normally are allergies, which can be seasonal or environmental, viral or bacterial infections like colds and flus, sinus infections, GERD or acid reflux, medications like birth control pills or antihypertensives, hormonal changes like pregnancy or menopause, structural issues like deviated septum, environmental factors like dry air or other irritants. So diagnosis is done through ENT exam, which is a diagnostic procedure performed by an ear, nose, and throat specialist to evaluate conditions affecting these areas. It's not a single test, but a set of examinations and possible investigations depending on symptoms. Common diagnostic tests can be a hearing test or audiometry. This measures hearing ability and detects hearing loss. Tympanometry, which checks eardrum mobility and middle ear function. Nasal endoscopy, which uses a thin scope to examine nasal passages and sinuses. Allergy testing to identify allergic triggers that may be causing nasal or throat symptoms. Laryngoscopy, which examines the voice box and vocal cords for nodules or inflammation. Imaging, like CT and MRI, for sinus issues or structural abnormalities. Balance tests to check for dizziness or vertigo issues. So the treatment depends on cause. So they may prescribe decongestants, for example, to dry mucus, antihistamines for allergies, mucolytics to thin the mucus, nasal sprays, saline irrigation, neti pot or saline spray, and of course, lifestyle changes like hydration, humidifier, elevated sleeping positions, etc. Some of the side effects for common medications that I mentioned are, and this is not an exhaustive list, of course, decongestants containing cold or sinus medications will often have mucus thinning medications like Mucinex, which can help mucus thin and transport faster. They can cause nervousness, insomnia, increased blood pressure. If your postnasal drip is a result of acid reflux, they may prescribe antacids or proton pump inhibitors or PPIs. I have a separate clip on GERD and acid reflux that you may find sort of helpful as it talks to also the side effects of taking antacids and PPIs. There's antihistamines that may be prescribed if allergens are to blame. Antihistamines and nasal steroids in combination can decrease some of the reactivity of both the nasal and tonsil tissues in the back of the throat, which can decrease mucus production and help with the postnasal drip. The side effects are sedation, dry mouth, thickened mucus, and more. Nasal steroids can address inflammation in the nasal passages and are used to help an array of conditions, from allergic to sinusitis, from allergies to sinusitis. Side effects include possible nasal irritation, nosebleeds, an unpleasant taste or smell, dry or sore nose, dry or sore throat, hoarse voice, headaches, or more serious side effects like problem breathing or damage to the nose or causing sores in the nose, as well as changes in eyesight like cloudy or blurred vision. In extreme cases, some people may need to undergo surgical procedures to get some relief. There are procedures for postnasal drip that are more for conditions that cause congestion. These are procedures to decrease the sensitivity of the posterior nasal nerve, so they can turn down the mucus production in the nose to decrease that drip and the drainage. However, the surgery is not without side effects either, as it can cause bleeding, and in some cases the surgery has to be halted due to excessive bleeding. Also, there's a possibility of recurrence of the disease and spinal fluid leak, because the sinuses are located near the brain. There's a chance of creating a leak of spinal fluid, which is the fluid lining the brain, or injuring the brain. This may create a potential for infection, which could result in meningitis. Or on the orthomolecular side of medicine, we emphasize correcting biochemical imbalances using optimal doses of vitamins, minerals, and nutrients. The key nutrients and compounds that are suggested are high-dose vitamin C, which is absolutely recommended for immune support and reducing inflammation in mucosal tissue. It can help thin the mucus and reduce sinus congestion. One thing that I need to explain before moving to other requirements is this. When we talk about high dose, it is a bit different than the high dose that you may hear from your conventional healthcare provider. They might consider 1,000 to 2,000 milligrams a day as high dose, where we do not. Now, if you're taking 1,000 to 2,000 milligrams a day, every day for maintenance, that might be fine. But when it comes for the need to fix after a break, we are talking much higher doses to build up to until all symptoms disappear and then going to maintenance mode. For various ailments throughout my career, I have seen from 10 grams a day, not milligrams, 10 grams a day to hundreds of grams based on individual need. So you'll be needing to work with your particular healthcare provider to decide on the required dosages based on your particular need. So next on the list of vitamins is vitamin D3 and K2, which supports immune regulation and reduces susceptibility to infections that can trigger excess mucus. Next is zinc, which plays a role in mucosal immunity and may shorten the duration of infections that cause postnasal drip. Then we have, then there is omega-3 fatty acids, which have an anti-inflammatory properties and may reduce chronic sinus inflammation. We have quercetin, being a natural flavonoid with antihistamine-like effects. It's useful for allergy-related postnasal drip. We have curcumin, or turmeric, having anti-inflammatory, antioxidant properties, which is beneficial for sinus health. Last but not certainly least, and quite effective, are probiotics. They support gut immune access, potentially reducing allergic responses and promoting health. I have a previous clip on pre, pro, and postbiotics that you might find helpful to watch. Saline or iodine nasal rinses have antimicrobial properties and can reduce viral or bacterial load in nasal passages, improving symptoms of chronic sinus issues. Steam inhalation with essential oils like eucalyptus or peppermint can help loosen mucus. Dietary adjustments like reducing dairy, which thickens the mucus, increasing hydration, and consuming anti-inflammatory foods. As I mentioned before, due to the numerous root causes for postnasal drip, the reason has to be identified before proper treatment is suggested. From metaphysical and emotional perspectives, sinus and throat issues are connected with communication issues. Postnasal drip is sometimes linked to unexpressed emotions, particularly grief or feeling overwhelmed. So practices that you might want to consider are meditation, breath work, journaling, and emotional release techniques, which are definitely suggested for healing. Hope this has been helpful. Like and follow for more. Be the light.